Well, treatment itself, initially the treatment really starts with your mastectomy and your sentinel node biopsy and lymph node dissection if you are unfortunate enough to have lymph node involvement. Um, and then, depending on the stage um, and the oncotype, if they oncotype the cancer at biopsy, um, that'll all determine whether or not you get chemo or chemo and radiation or just radiation. So initially, there are a lot of doctor's visits. And then you have, in my case, I had 6 rounds of chemo, 1 round every 3 weeks, over 18 weeks. I had aggressive chemotherapy of adriamycin, Cytoxan, and Taxotere, all in one serving per visit. Then I had about a month off, which was at least somewhat restful. And then I went for 25 daily rounds of radiation. The chemotherapy, the first day after chemotherapy or the first 2 days aren't so bad in most cases. They can control nausea with different medications. So if you're having any kind of side effects, to be sure to let your doctor know or your oncology nurse know, so they can include those medications. And then, the third day, through maybe the 6th, 7th day, you feel pretty lousy and you sleep a lot. So you really need to be in a place where you can nap. I seem to nap in 4-hour intervals. So I had a recliner, which I called my chemo chair. And I just parked myself there and settled in and just didn't do a whole lot but rest. Radiation, on the other hand, the radiation oncologist called it generous radiation because he tends to, I've forgotten what the phrase was, not updose, but he would give stronger radiation rather than, maybe standard, to be sure that he's getting the effects he wants. That will leave you with a slight burn the first week or so, right through to the end. In my case, they did 3 angles of radiation, and they can contour, for those who don't know, they can contour the radiation to a very specific area of the breast. And the first 10 treatments, they had a gel pad about yay big that they placed on my chest, which they told me kept the radiation more at skin level. And then from treatment 11 through 25, they didn't use that gel pad, so they can, get the radiation deeper. And that, left me with a permanent area that doesn't grow hair. 5 years later, I've got just a few little sprouts. But the radiation isn't as bad. I mean, you go in, your total time at the cancer center is usually about a half an hour. The radiation itself is 5 to 10 minutes, if that. By the time you get in and take off your shirt and lay down, and they line you up, so they get you in the right spot. They do place little tattoo dots to mark where you were during the preliminary pre-treatment treatment, I guess, if you want to say that. And then they line you up that way. And the radiation, when you come home, it leaves you fatigued. And you'll be sitting there, and then all of a sudden you'll just have this kind of wave of fatigue wash over you where you just can't, you just don't want to pick up your head. And you just feel like you want to nap and relax. I don't know how people who do it, who go back to work right away. Um, I don't know if women are stronger than men or not, but I've heard many women who've been treated for breast cancer who said, "Oh yeah, I go to chemo on a Friday, afternoon, and then I'd be right back at work Monday morning." And I just didn't see myself doing that.